This month of September is every year we observe it as leukemia month or lymphoma awareness month. So leukemia is a disease when anyone hears that really it creates a tension in their mind. But first we should know that how to suspect leukemia and how do we reach a diagnosis of leukemia. Common symptoms that a person can have in a disease like leukemia is that a patient will complain of fever. Fever is the commonest symptom. Fever that is more than temperature will remain more than 101 degree Fahrenheit, and it won't go away with taking antibiotics. Though paracetamol can bring down the fever, but the fever will be persistent. Next is that the patient will complain of body ache, bone pains that is quite severe in nature, and the third most important thing that the patient do have is the bleeding manifestations. Bleedings can happen from gum, bleeding can happen from nose, and bleeding also sometimes happen in urine, and there is also a variant of leukemia called acute promyelocytic leukemia where bleeding is the commonest presentation. Then there are organomegalies. Organomegaly, to be said simply, people can have enlargement of abdominal organs like spleen and liver. Also some patients can have also enlargement of neck nodes. So these are the most of the clinical findings that a patient can have, and with this they should report a doctor, preferably a hematologist or a hemato-oncologist, and get a complete blood count done. And in that blood count what we get anemia, we can get low platelets, and we get circulating immature cells, which is technically known as blast cells. So this is in nutshell what is acute leukemia and its clinical manifestations. But there are now excellent treatment that are available both at all centers in India and also in West Bengal. There are many trained hematologists, oncologists to treat those patients, and I expect that if a patient sticks to his treatment protocol at a particular hospital under oncologist or a hematologist, so they will get the best of results. And one should not be afraid that I am having leukemia, I am having less number of days, because we have also many success stories of cure rates of more than 5 years, 10 years, and having long-term survival. And it's an ongoing field of medical research, an ongoing field of medical study, and right now we have brilliant doctors, and I wish a good and successful treatment for all patients.